Let's study about Alzheimer's disease. Alzheimer's disease is a chronic neurodegenerative disease. Neurodegenerative means here the neurons they get degraded. It usually starts slowly and gradually worsens over a long period of time. It is a progressive disease that destroys the memory and other important mental functions of a person. It is cause of about 60 to 70% cases of dementia. Dementia is nothing but it is loss of memory. The early symptoms include difficulty in remembering recent events. Further, it leads to loss of motivation, not managing self-care. The person becomes totally dependent on caregivers and family. There are some behavioral issues. Also, it leads to problems with language. As the disease progresses, the person he loses his ability to talk because he starts to forget the vocabulary. Then as the disease still progresses further, he might even lose his ability to read and write. And then a time comes when he can only signal or sign whatever he wants to say to other person. Then there occurs disorientation, including easily getting lost, and there are mood swings. There is a continuous decline in the thinking, behavioral, and social skills that disrupts a person's ability to function independently, and the person he becomes dependent on others. The sign and symptoms include, these are divided into 4 stages. The first one is pre-dementia stage. It is related with stress or aging. The daily routine activities are difficult to perform. There is short-term memory loss affecting the execution of functions of attentiveness, planning, flexibility, and abstract thinking. The next stage is the early stage. In this case, in this stage, there is increasing impairment of the learning and memory. There is difficulty with the language, executive functions, perception, or execution of movements. The third is the moderate stage. Here, the subject being unable to perform most common activities of the daily living. He cannot recall his vocabulary, reading and writing skills are lost. There is a less coordination in motor system. Person tends to fall. He loses his ability to balance. There are memory problems and it gets worse and worse, and it becomes so pathetic that the person may fail to recognize his own close relatives. The advanced stage includes the patient is completely dependent on others. There is complete loss of speech, decrease in the muscle mass, and motility. Ultimately, the person becomes bedridden and it dies due to secondary causes such as infection and sores. Etiology includes, there are many hypotheses. One reason it might be genetic, it has got genetic links. The second can be the tau hypothesis. Third can be the amyloid hypothesis. And fourth is the cholinergic hypothesis. It was thought earlier that there is a decrease in the acetylcholinesterase activity level in the body, but it was found that even if the person is treated with adrenergic substances, there is no repairment of this type of disorder. So now today we are going to mainly focus on the two hypotheses, and that is tau hypothesis and amyloid hypothesis. So we'll take a look at the pathogenesis. Alzheimer's disease destroys the neurons of the brain that control the memory. Initially, hippocampus is damaged, which is responsible for controlling the short-term memory, leading to short-term memory loss or failure and decrease in the ability to perform the regular routine tasks. Then it affects the cerebral cortex, which is responsible for language and reasoning, with the loss of inability to make judgments. Thirdly, there are personality changes which occurs, and there is emotional outburst, wandering, and agitation. Slowly, other brain parts are involved and the brain shrinks and loses function. Finally, the person becomes bedridden, incontinent, and non-responsive. You can see here the mass of the brain in the person who is suffering from Alzheimer's disease is shrinked. Okay, so you can go for CT scan for the diagnosis. If the person's brain is reduced in size, you can say that the person might be suffering from Alzheimer's disease. Now, the brain gets clogged with two abnormal structures. The first one is the neurofibrillary tangles, and the second one is amyloid plaques. Okay, you can see here the normal neuron region is shown, and the neuron region of a patient is shown. You can see in the Alzheimer's state, there are neurofibrillary tangles and amyloid plaque accumulation inside the tissue. Now we'll take a look at how the plaque is formed. The plaque accumulation occurs, and it is accumulation of abnormally folded amyloid beta, A beta protein, and tau protein in the brain. Amyloid beta is a 39 to 43 amino acid chain length. Amyloid beta is a fragment from a larger amyloid precursor protein, APP. This APP is nothing but it is a transmembrane protein that penetrates through the neuron's membrane. APP is critical to neuron growth, survival, and post-injury repair. So you can see here, these are the transmembrane APP. These are the long chain polypeptides. Okay. Now what happens? This transmembrane proteins, they get degraded. In the Alzheimer's disease, the gamma secretase and beta secretase are activated, which act, these are the enzymes which act for breaking the APP molecule, and it acts in breaking the chain. You can see here, this enzymes, they are acting for breaking the molecule. Due to this breakdown, the fragments of beta amyloid, they are produced and they start accumulation into the tissue. Now we'll see at the neurofibrillary tangles. Every neuron, it has a cytoskeleton which is made up of structures called as microtubules. These microtubules, they act like tracks or for guiding the nutrients and molecules from the body of the cell to the ends of the axon and the back. A protein called as tau, it stabilizes the macrotubules when phosphorylated. In Alzheimer's disease, tau protein undergoes chemical changes, becoming hyperphosphorylated. It then begins to pair with other threads, creating neurofibrillary tangles and disintegrating the neuron's transport system. These changes in the brain interfere with normal communication between the neurons, and formation of these plaques and neurofibrillary tangles causes apoptosis of the neurons, ultimately killing the neurons. The diagnosis is based on medical history. Initially, the doctor is going to perform a physical exam and likely assess overall neurological health by testing the following points, such as your reflexes, muscle tone and strength, ability to get up from a chair and walk across the room, sense of sight and hearing, coordination, balance. These then advanced medical imaging techniques are used, like CT scan, MRI, SPECT, or PET are performed for confirmation. The treatment includes acetylcholine esterase inhibitors like galantamine, rivastigmine, donepezil, and tacarine. Sometimes antidepressants, sedatives are also given to the patient. So this was all about Alzheimer's disease. Thank you.